Hello, everyone. You're welcome to Science Podcast with Akiri Oladimeji Philip. How has been your week and all? On today's edition of the podcast, I will have a crash class on the following. It is specifically for my IJMB students starting their exams next week. However, I will only talk about three things on this flow chart, which is ginger, Agama lizard, and blood smear. The second video we have the remaining parts of this flow chart. All right, the first on my list is ginger. These are the classification of what ginger is all about, the kingdom to the specific name, the species. Now, please don't be carried away with the clad thing written here. They just mean the same thing as division, class, family, and all. As you have them normally. Now, don't get carried away. It's just the normal thing. However, the whole thing here, the major thing you need here are three, which are the family, the genus, and the specific name. So please take note of that. And the binomial name, which is the combination of the generic name and the specific name, is Zingiber officinale. Please take note of that. Those are the things you need here, basically. All right. All right. Now this is a ginger. It's a rhizome because it's a stem, a crawling stem, as it were, an underground stem, as it were. That's how it looks like. It's very easy to draw. What you should do here is you could pause the video to take a look at this. It's just as if when you want to draw it, as if you are drawing a caterpillar. Sorry for that. As if you are drawing a caterpillar, you could see the segment here. You could see the adventitious root here. So you just draw your adventitious root. You can see new rhizome growing from an axillary board. It's simple. Just rehearse it. It's going to stay. All right. Just pause the video to get a glimpse of how the diagram looks like. All right. Method of propagation. Ginger is cultivated vegetatively from its rhizome. Just from what you have seen back there. All right. Now, the economic importance of ginger refers to basically the things it can do and the bad things it can also. Now, basically, the most things that ginger is known for are basically medicinal, sincerely. But other thing it does is you can say it's a source of income because it is what people sell. People make money from ginger. In fact, people export it out of the country to other countries. So it's a source of income. And it's the medicinal thing it has, just a summary is okay. It's anti-emetic or anti-nausea, I mean to say. Anti means against. Now it means emetic or nausea means the feeling of like you want to vomit. So it helps to prevent people from vomiting. Basically, that's what it means. So it prevents vomiting. Then it is what anti-spasmodic, which means it prevents spasm. Spasm is just what I call that's involuntary contraction of the muscle. Your muscle is contracting against your other. You are not asking your muscle to contract, yet it's contracting. That's called antispasmodic. Then we have antifungal. It prevents fungal kind of diseases. Then anti-inflammatory. It prevents swelling. Antiseptic. It means it prevents germs. All right. And antibacterial. It prevents bacterial growth. All right. It is antiviral. It is antitussive. It simply means that antitussive means that it prevents cough. So most times, in fact, a lot of people have used ginger as a cough regimen, which helps them to relieve cough and all. Then it is analgesic in nature. That means that it can relieve pain. And it is circulatory stimulant. It's hastening the rate at which our blood flows. Then it is what carminative. Carminative means that when you have stomach upset due to gases in our stomach, not due to indigestion like constipation. No, it's like, let's say due to gases. Let's say, for example, you've eaten spelt beans. Your stomach now swells up. You're now feeling all those sound of like that. Ginger can be used to offset and reduce that abdominal pain. All right, so it is carminative in nature. And then well, as good as ginger is, it has its bad side, which are the harmful effects. If it's taken too much, like I always say, too much of a good thing could become bad. So as good as it is, it could cause heartburn, stomach upset, mouth irritation, diarrhea, cardiovascular system changes in the heart's rhythm. then the risk of bleeding. Please, the risk of bleeding here does not mean hemophilia. All right. Now the next thing here is blood smear. Please don't be confused when you're saying blood film. It means the same thing. So a blood film or peripheral blood smear is a thin layer of blood smeared on a microscope slide and then stained in such a way to allow the various blood cells to be examined microscopically. This is simple. So if you're asked to define what a blood smear is, just write this, please. Just, you may not write the blood film, you might write it if you wish. It means the same thing. Now you will be wondering why that we have a purple thing here. The reason is because it has been mixed with a reagent. You can see this is thin, this is thick, this is thin. Now they were once red initially but became purple because something has been mixed with them. So what we mix with them are the reagents. So they are the stains, and those stains are the ones that will reveal the component inside the blood. You see that in a minute from now when I show you what a blood smear looks like. All right. Now, to understand what blood smear is, you need to understand the component of blood itself. The component of blood is the plasma, which is the non-cellular component. We have the cellular component of the blood. Now, in blood smear, what we are concerned about is we want to see the cellular component of the blood, which are the platelets, leukocyte, and the erythrocyte. Now, you can see that the leukocytes, otherwise called Buffy coat, Buffy, then COAT, Buffy coat. It means the same thing. Now, these are the content of the Buffy coat or leukocyte, which is granulocytes, which are the neutrophils, eosinophils, and the basophils. Then try to take note of the percentage. They might ask which of them has the highest percentage. Then look at the agranulocyte, where we have the lymphocyte and the monocyte. Then the erythrocyte is here. You can see the platelets are this left hand side too. All right, this is the most important slide here, talking about blood smear. It's very important to understand this slide. This is what is expected to see under the microscope. All this biconcave things that doesn't have any bluish stain or purple thing amongst them are the erythrocytes. You need to know these things. And all these ones that have bluish stains here or purple thing are the eosinophils, are all the white blood cells. You can see this other one too here. It's another form of white blood cell. While these tiny ones that you just want tiny bluish stain here, it's not as if, in this one here, this eosinophil and all, it's as if the bluish stain is inside something. But when you see just a blue thing standing on its own, you can see that is what platelet. This is what you need to understand. What you are doing here is going to be, what you need to understand is you need to know the function, the description of each of those things. You see that in the next slide. So it's simple. You just have to know this diagram in your head, this slide in your head. All right. Now this is a summary of formed elements of the blood. This is how it looks like. You see the red blood cell, the erythrocytes, which then you can see their description here. Now I want to call your attention to something. You see the description, the cell, the number you are meant to have in a cell. That's what you have here. The number you're supposed to have, the cell centimeter cube of blood. Then the duration means the D, that is the lifespan. The number of days it takes to form it. Then the LS is the lifespan it takes for it to live and die. So you can see the one of red blood cells here, which is erythrocyte. You can see it takes 100 to 120 days. All right, you can see the function here. So do that for the remaining ones. So you might need to just pause the video here. You pause the video, write out the table. All right. The same thing here, the cell type, illustration, description, the number in the blood, duration, and the function. All right. All right. What are the uses of blood smear? Well, it is used most time diagnostically to check what is wrong with somebody. Sometimes it's just to count the number of cells, and counting the number of red blood cells and white blood cells is also for a diagnostic thing. You want to know what is wrong with the person, because when you have some diseases, it makes it increase or decrease. So it is basically for diagnostic purposes. Now, number one is it can be used to test for anemia. Anemia is a reduction in number of blood cells in the body. So it can be used to see whether the person's red blood cells are much or less. So anemic patients are going to, when they look at their blood smear, they will have little number of red blood cells. Now we have something called polycythemia. Polycythemia means that the number of red blood cells are too much, far too much. All right. Then we have thrombocytosis. Thrombocytosis means that the number of platelets are so little, from the word thrombo, so they are so little. All right. And we can also have leukocytosis, which means the number of white blood cells are too little, and that means they are too little. Then we can also have what's it called, thrombocytopenia, which means the number of red blood white sorry, I beg your pardon, thrombocytopenia. That's this when the number of thrombocytes, which are the platelets, are also too much. All right. Then here we have presence. It can also be used to detect the presence of bacteria in the blood. You can see here plasmodium, which is a protozoa, and trypanosome can be seen in the blood cell of somebody that is having that. All right. Now this is trypanosome in the blood of somebody, and trypanosome causes sleeping sickness basically. So you can see it is seen in the person's blood. All right. Yes, now we talk about Agama lizard. Well, Agama lizard is actually we have different kinds of lizards, but here we have Agama lizard, which is Agama. That's the one we see around our houses. You see that in a few minutes from now. Now, what is Agama lizard? It's a reptile. Why? Because it belongs to kingdom Animalia, phylum Chordata. Then you look at other things it has like that. You might want to read up that. It is a reptile, that's class Reptilia. Now, the reason why it is called that is because it has presence of horny scale on the skin, presence of fore and hind limbs with clawed digits. Then it is homodont. Homodont means all the teeth it has is the same shape. It doesn't have let's say canine incisors or no, everything is the same. All right. Then it has a well-developed retractable tongue. The mouth is wide. Slit is present at the anterior end of the head. All right, this is how it looks like. This is how it looks like. Male Agama lizard. You might want to pause the video here, practice the drawing. Look at how it. When you're asked to say what are the physical appearance, what are the observable features of the specimen, just look at the things you could see: the gular fold, the crest, the knuckle crest, the eardrum. And another word for eardrum is tympanum. Tympanum. All right, the bulging eye, the nostrils, the forelimb, the cloaca. Now you might be asked, what does it use for defense? What is used for defense is basically its tail. Yes, it uses that to fight when another male lizard tries to enter its territory. All right, so to pause the video here, practice the diagram. It's simple. All right. Now this is a note I've prepared on Agama lizard. Just pause the video and write the note. All right, I don't want to make the video too lengthy, so the size won't be too much. All right, you could see that also. Pause the video and write the note. Pause the video and write the note. Now this is an internal structure of a female Agama lizard. Just look at it here and look at how it's not hard. It's just the normal thing any other organism will have: the stomach, the lungs. Just know what this thing does in mammals. Basically, lungs is for breathing, stomach is for storing food, but just the orientation. All right. It has cloaca. All right, take note of that. It has urethra, so that means it can urinate. Also, it has kidney, so it's simple. All right. Now, this is a general structure of the digestive tract of reptiles. It is simple. You could draw this. You have to draw the digestive system of a reptile. Just feel free to draw this. It is correct, but don't write the same way it is written here, like writing one leave. I know. Write your drawings. Label it out. You don't have to write it at one side and do like it's written here. Understood? All right. Thank you for the time. I hope this helped a little bit. If